Welcome to our new podcast today. We're here today with Steve Buchanan, world famous endodontics. You graduated at Temple University
a long time
ago. And you have a private practice now in Santa Barbara,
I do.
California.
Yep. Right next to my training center.
All right. Okay.
Yeah.
Beautiful place in California. A lot of sun.
In February, it's 70 degrees. So,
yeah. It's a nice place to live and work, I can imagine. We were here today in the CIDE Center in Den Haag. CIDE is for a Center for Innovative Dentistry Education. Mm-hmm. They mainly focus on endodontic education, and that is your speciality, of course. We were talking today about, because I'm a general practitioner here in the Netherlands. I thought I knew something about good endodontic treatment. It was a couple of years ago that I did a good course, but I learned so much today.
Thank you.
So very thankful for that.
Wow.
You introduced a new term for me, the minimally invasive endodontics,
right,
which is completely new for me, and it's suits completely with the philosophy we have as a common dentistry, to be as minimally invasive as possible. Do the kind of dentistry.
It's the same trend in medicine and other areas of dentistry. There's no rationale for wasting a part of a patient's body. Right. If we can do the job and save more of their tooth structure, that's a really good thing. Yeah.
So you mentioned that just in my perspective up till now, the filing was part of the cleaning process, but I was completely wrong. I learned today.
That's what we all got taught.
Yeah.
It's not your fault. Right? Yeah, no, we were taught that you use files to clean and shape root canals. The cleaning was all done by the irrigating solutions that we were using it with. Mm-hmm. The files, it turns out, actually make a huge amount of debris. Mm-hmm. Canals are more dirty after you use a file in the root canal than they were before you got in there. So what does that tell us? That tells us that once you understand that you're not improving things by cutting more tooth structure, then you realize the only reason we're instrumenting is to make sure we have enough room to irrigate and fill. If it's a young patient's tooth, we don't have any calcification. I have cases where I've not cut one iota of dentin in the root canal. I just soaked it with hypochlorite for 30 or 40 minutes and filled it, and they work perfectly. Wow. So it's not about cleaning. It's about preparing the tooth in each root canal for the irrigation that follows. And irrigation is the most important thing of all.
Yeah.
That's the thing that if you did nothing else except irrigate effectively, they would all work.
So the debris that you create by filing, you mentioned that you use EDTA during your shaping of the root canal. Can you elaborate a little bit more about that?
Yeah, and sometimes the simplest things there's disagreement about. 95% of all the endodontists in the United States instrument with hypochlorite in there because that's the way Herb Schilder taught us. Yeah. And Dr. Schilder really set the stage for what the best outcomes in endodontics could be. The problem is, as practitioners, we remember that, but we don't recalibrate based on the tools that we have now. And it's a whole different story. We don't want to cut big access cavities. We don't want to cut a lot of shape. We do need to irrigate effectively. Yeah. And one of the unintended consequences of our rotary instrumentation revolution was it shortened all of our shaping times, and we started seeing failures from our irrigation. Yeah. But most of the endodontists didn't know that was why it was happening. Mm. But a large number of endodontists in the United States went back to 2-visit endo when my generation was a generation that said, no, you can treat everything in a single visit. And there's no patient that's ever wanted 2 visits if they could have one visit.
Yeah,
right?
Obviously.
They'll pay you more for one than two. Right?
The files you're using, they're smaller in diameter and smaller in taper.
Right.
So you cut off much less coronal dentin.
Exactly. These files have lesser tapers. The taper used to be really important, and that's when our tools weren't very good. We had to have a 6 or an 8 or a 0.10 taper. Now, if you have the narrowest diameter at the end of the root canal, whatever happens up above there, it doesn't make a big difference in the outcome. Yeah. So, of course, we would choose to cut less if we can.
Yeah, and save that important coronal dentin. That's so important for keeping tooth sound and give them this elastic structure that it can function like a normal tooth.
It's pretty amazing that teeth last as long as they do. When patients tell me, you know, how come my teeth are cracked, you know, I tell them, what else do you own that's 50 years old or 60 years old that hasn't broken and needed repair? So teeth are the ultimate composite material. Yeah. The mineralized and the organic component of that makes it flexible and strong at the same time. Yeah. So, but we do want to preserve it. Yeah.
Before you do any cleaning, we do a lot of IDS, immediate dentin sealing. Are you worried about your dentin during the cleaning with sodium hypochlorite? Sorry.
Right. Could you explain a little bit about immediate? What was the IDS?
Immediate IDS. Immediate
dentin
sealing is that you the freshly cut dentin that you expose, you want to treat that immediately. You have
that's so great.
Yeah. So the adhesive procedure on dentin is much more difficult because of the less hydroxyapatite and the more collagen that is inside of dentin. So I was always worried that during an endodontic treatment, my dentin would be less of a quality to get good adhesion on during an endodontic treatment. What's your view on that?
Okay. First, I'd like to make a comment about IDS. That is so brilliant. Okay. When I started doing root canal therapy, nobody sealed anything, and they put provisional crowns on after they did full mouth preparations, and they would have 3 or 4 teeth with pulps that were killing them. And the margins were always short because they knew that that was a little healthier for the gum tissue, and so it's like having exposed nerves. When we started seeing composite resin cements come in, also we saw so many of our cases, the pulp died 5 years after the crown was placed. It was back in the days of, what was the old cement? It was the Crown and Bridge cement that everybody used washed out in about 5 years. And so we used to think that we needed to do a root canal 5 years after the crown was placed because the pulp was injured and it survived, but it slowly decomposed and dropped over the threshold of vitality. Really what happened was the cement washed out, the bugs went through the dentinal tubules, killed the pulp. Exactly. So when you seal those things the day that they're cut, we don't need to do half the number of root canals we used to after crown preps. Yeah. That's really fantastic. Once the pulp's dead, does it really help? Not so much. Okay. Because we have a hemisphere of moisture delivering vascularity and tooth structure. You know, dentin is essentially a hard tissue sponge, right? You can't totally desiccate it. That's why bioceramics are so great on it. And if the pulp is gone, the effects of what we do on the surface of the root canals are not going to influence what happens long term with the tooth. Cutting too much tooth structure, that's a big difference. Obviously. Yeah. So there's a lot of paranoia about if we have hypochlorite in there too long, are we dissolving the collagen component of the dentin and making the tooth more brittle? There's the old myth that endodontically treated teeth are dried out, which is impossible. They're in a 100% hydrated environment. They never dried out. They became weaker because we overcut the access cavities. Yeah.